First of all, imagine a DC kid, looking at a map and going, what would the farthest place be that I could hitchhike to? Where could I go? And Oregon, seemed pretty far. This was 1971, and in my pack I had 2 documents. One was a tattered manuscript that became Our Bodies, Ourselves, and the other was a document called the Gay Manifesto. So I brought this sense of urgency, activism, and music. I entered college, and then pretty shortly after that, proposed to the Jackson County Health Department about this manuscript I had about our bodies ourselves. I mean, women could actually hold specula in their hands themselves and gain the power of understanding our own bodies. The proverbial dilemma, finding a balance between bureaucracy and chaos. In the early 1970s, we're fighting every structure of power in this country. So imagine the miracle of walking into what you think is going to be, I got a fight here. This is going to be a fight. You're going into the Jackson County Health Department and posing an idea, a radical idea, and having them open their arms. It's almost like you get the air out, where's the fight? It was an astounding moment. And so I was thrilled to find a public health department. I don't think I knew at that time at 19 years old that there were such things. But in any case, they were very interested. Al Kearns was very interested. And they suggested to send me to Seattle to become trained as a VISTA volunteer. So I went around to different health centers. There wasn't a women's health center, but I went to health centers, health clinics in different neighborhoods. And at one of the clinics, a couple of the people said, hey, there's this giant warehouse in Seattle, just a little bit outside of Seattle. And all of the doctors can leave their equipment and you can go there and get stuff. The only thing I can describe it to you is if you imagine Costco now. I mean, it was so big, and there were just aisles and aisles and aisles. There's everything from the lenses, the prism lenses that an old optometrist would use to hold up to the eye, and there were these tuning forks that I guess were used by ear doctors. I mean, it was stuff from the 1800s and 1900s that was in there. It was incredible. I mean, so I just went and picked out everything for the Ashland Women's Health Center, except there was just one problem. There wasn't a center yet. I was just going up there to be trained to figure out how to create it. There weren't many women's health centers around the country in 1971. I mean, this was one of the first. I didn't understand that at the time. This was a moment in the women's movement of really trying to understand empowerment. It's important at the beginning, and I'll say this over and over again, to say that it wasn't only me. I might have had the idea, but it was a group of women that created this Ashland Women's Health Center.
The practice of good medicine comes as much from the heart as it does from the mind, and I was looking for a community where I thought that both those things were encompassed at a high level. I think it was in the very early 90s. I'd been here 20 years at that point, and I was pretty sure that the medical community was serving our entire community. Well, it turns out I was wrong. And Peg Crowley spoke at our medical society and said basically to all of these doctors who also thought they were serving the entire community, you're not. There's a third of the people in your community who can't get in to see you, except through the emergency room in times of crisis. So the next day I called Peg and I went down and basically volunteered at the Community Health Center. So I sent out a letter to all the members of the Jackson County Medical Society, which I think were about 200 at that time, and basically said, if we could guarantee that you would see only as many people without insurance as you yourself would tolerate, how many a year would you see, and what might you donate to their care? And 85% of the physicians in Jackson County volunteered some type of medical care, many of them a lot. I was at that time the president of the Medical Society, and basically that meant that you got to organize these monthly meetings and invite whoever you wanted to come and speak. And I'd met Peg somewhere in the community before that time and invited her to come, and she did. And lo and behold, what came out of that was Volpact, and that just blossomed, and there was a great need for it. So I had really honestly been operating under the illusion that I was providing care to the entire community. That was true through the emergency room, because the hospitals were obligated to provide care to everyone, and I was a part of that. But I was also under the illusion that we were also serving the outpatient community the same way. Not true. And Peg said, that's what we do here, and I thought, I need to be a part of that, because that's going to be the fulfillment of my vision that medical care for the entire community could be provided in a small town, small community, at a very high level.
And I started working at the Community Health Center around 1989 or so. And I got hired to work at the clinic in Medford, which was in the Sacred Heart School, the second floor of the Sacred Heart School offices. I did hospital nursing before that, but I liked this. I learned a lot in my career, doing everything. I just loved learning wound care. I loved learning about nutrition. I loved learning about diabetes meds and insulins, and I mean, it just goes on and on and on. I saw the Women's Health Center probably 1979, and it caught my eye. But I went up there and actually was a client and had a pregnancy test. So that was my first experience with the organization. It was pretty hippie. It's comforting to go someplace where you know they're going to work with you and you know what you're going to pay. So that's something I really liked about the Community Health Center my entire career there, was because you could go in and say, how much is my visit going to be, and they could give you a price. And I don't think that happens very much in healthcare now. It was our goal to be accepting, regardless, to be warm and accepting and welcoming.
I joined Community Health Center in 1991. And at that point, I was in the Medford site, which was upstairs in the Sacred Heart School. And that was an interesting experience in the summers in particular, because you'd hit 2 o'clock in the afternoon in a Southern Oregon summer with no air conditioning, the upstairs of a building, and your glasses would just be doing like this, sliding down the sweat on your nose. I want to be of service. I want to be helpful. But what you do in healthcare is predominantly, in my opinion, is we gift energy. And it's staying in tune with that individual's needs. So you meet them, try and meet them where they're at. I was at Community Health Center from 1991 until 2007. So there's a lot of changes that have happened since my tenure there. The changes that occurred while I was there was certainly, we were able to move to our own facility on Myrtle Street. We had the 4th Street Clinic in Ashland, and then we were able to move that to the building on Front Street where it is now. And part of what was able to fuel that expansion was we did finally, after much teeth gnashing, opt to become an FQHC. When we first started, we'd hit the end of our fiscal year, we would be darn near out of money for the month of June, and we'd be down to just a skeleton crew to keep things rolling and do what we could for the population we served until the plant was watered again on July 1st.
When you walked in the door, there was a sink along one wall, and then there was a little desk where we checked blood pressures. And then there was a chair where we drew blood, and there was a desk, and I sat there with Alice Nagel. We shared it together. There were 2 chairs, but 1 place for your legs. We had an incubator and a centrifuge and a microscope, and no air conditioning, so it was pretty hot in there.
When Peg started here in Ashland, they started in a closet, really, and by the time I joined, we were in Medford, and in fact we were in 3 sites by then, but the facilities were pretty bare and skimpy, and our records were all written in by hand in little notations, and there was no system for keeping them, and so the nurses at the Community Health Center became responsible for coordinating all of this, and it was a monumental task. Now, wonderful equipment. Down at the Community Health Center, you literally press a button, and you have this person's entire medical history, the results of all the tests and so forth, at your fingertips.
It is all about the mission and believing in the mission and that desire to really help people. And regardless, that's what underpinned all of our efforts. And it was a shared feeling, I think, among all of us that hung out there for so long. While I was there, we really didn't have a whole lot of staff turnover. We had a pretty stable crew for the whole time.
Working at the Community Health Center at the time, the benefit was the camaraderie.
We could survive the tough stuff, the difficult patient scenarios, because we had each other to lean on, and it's what made it, it made it still fun to go to work, even though.
Like family.
Yeah, we're a big family.
Healthcare in the United States is fragmented into silos. Private silo, the hospital silo, the outpatient specialty silo, and the silo for people who are dependent upon others to finance their care.
Healthcare is certainly a part of what makes a healthy community, and one entity can't necessarily provide everything necessary to create that healthy community, but can be a portal to access those services as appropriate that somebody needs. We're a portal for you to access cardiology. What about housing? What about food? What about training for where you'd like to head employment-wise? What about assistance with childcare? I'd like to believe that there was nobody that we were not willing to provide health care to.
Before the Oregon Health Plan, there was not much going on for people that didn't have money and didn't have insurance. There was lack of access to specialty care or any health care. The importance of the Community Health Center and prior to the Oregon Health Plan was access to general care for folks. And I think if people didn't have resources, they went to the emergency room for things that could be easily treated at a clinic. Ear infections, strep throat, bronchitis, just acute illnesses that shouldn't require an emergency room visit, and then get stuck with a horrible bill. To me, a vibrant, healthy community looks holistic. It looks like it addresses not just physical health, but mental health, housing stability. The whole person and the whole community is treated.
There are still parts of our community where medical care is not easily accessible. But nonetheless, we've come a long way. We've done a pretty good job, but we still can refine what is here and continue to make it better and better.
In general, I would really love to see it become a bit more inclusive and open. And for Rogue Community Health specifically, to continue to grow the pathway that it is now on under the guidance of William North, which has been remarkable, and the future is bright.
I loved that job. I just loved that job. I mean, it made me feel valuable. It made me feel like I was helping.
We have a lot of work right now. I mean, this is a really, really tough time in health. The health of individuals, the health of people in the Rogue Valley, the health of our earth. My hope is that there's something about something we did, the boldness and the just unrestrained naivety that informs those who are going to carry on the organization as it exists today. My dream is that you'll just keep looking at the hard issues around health and just be unafraid and just know, if you're still there in such a developed stage out of this little seed, anything can be possible.